Hey, John, where was our pie on Pie Day this weekend?
You know, you had to come in the store. We sold over 1,000 slices. All right. Hello, everybody. Welcome to the Northeast Report. We are in week 7. This is January 26th, our regional report outs. And we are here every Tuesday right now at 2 o'clock to give you an update on what's going on with the coronavirus in your region and part of the state. I'm going to go into our dashboard as I usually do, and then we'll hear from public health. We'll hear from hospitals. We have special guests. We have Dr. Watson back with us again to talk about the transfers, and we'll have Dr. Marcy Nielsen, who is helping lead the efforts around the vaccine in our state as the Chief Advisor of COVID-19 Coordination. It's good alliteration for a title there, and she'll be able to answer some questions for us. So I'm going to launch right in because I know we got a full stacked call today, packed with great information. So let me pull up our dashboard here. Okay, so you can see Northeast. One thing we're really highlighting on this call, so we've talked for weeks about the critical staffing shortages. And as that number has been going down, it's important to point out that the real thing as hospitals are marking this is this idea of critical staffing. There are still staffing shortages, and we are still asking a lot, particularly of our nurses in this time frame. So this doesn't mean that 90% of hospitals are peachy keen. It just means that they're not in the critical aspect for this week. So I just want to make that clear. Coming across, looking at hospitalized patients, I found it this week good to look kind of on a 2-week look back effort, show kind of the good news and the trends that we're seeing. So this is suspected or COVID patients hospitalized in the Northeast region. 2 weeks ago, that was 161. Last week, 135. This week, 112. That's really good to see that moving. Now, COVID patients in the ICU, 2 weeks ago, that was at 29. The last 2 weeks, that's been at 21. And then coming over here for adult staffed ICU beds available, that's the number you want to see go up. It was 27 2 weeks ago, 30 last week, 34 this week. That is a dynamic and fluid number, but that has gotten us to a 30% on our availability of ICU beds in the Northeast. Now, if you look down here with me, you'll see we haven't quite gotten the full downturn in this region as we have in a lot of the other regions. Things kind of came up here and spiked in November, came down, and then have come back up to some of those higher numbers at 35, 76. Now, good news on that. For the Northeast region, we are at 6.35% positivity rate. That is the lowest that we've seen since October. I'll show you this is a KDHE site. Ignore the last set of dots here because it's kind of in motion for the week. But you'll see 2 weeks in a row of sub 10% on positivity. That's really good. And looking at Northeast, you can see you have to go all the way back here into October before you see us around that 6% number. So that's a good sign. Doesn't mean it's time to go out and party, but it does mean that the effort and the sacrifices everybody's making is having an impact. So this is dashboards, and it tells one story, but the real story, as we find week to week, comes from our people on the ground. And so let's hear from public health, and I'll kick it over to Derek.
Thanks, John. Yeah, the dashboard really kind of tells the story, I think. Just as recent as 2 weeks ago, we were dealing with some record highs as far as cases per day, cases per week. We hit a record high, but we've really seen an improvement the last couple of weeks. You hit the nail on the head there with the percent positivity. I know here in Shawnee County specifically, we're sitting about 8%. So a little bit higher than that regional average, but we've been above 10 for several weeks in a row prior to that. I think another positive thing, we've seen those hospitalizations kind of steadily decrease, and so that's always nice to see. And I hesitate to say they're getting some breathing room, but I think it always helps. So something that you hit on, John, that I would like to reiterate is just kind of thanking those people that have followed our recommendations for almost a year now. I mean, everything from all of the mask wearing, the hand washing, putting off family gatherings, birthday parties. We're so grateful to everybody for all of those sacrifices, and really just want to specifically thank our healthcare workers, nursing homes, schools, businesses, everybody that's had to adapt. To those that haven't been following our guidance and recommendations, I think I've mentioned this before on this call, but one of my favorite quotes is, "The first best time was then, the next best time is now." And we just got to stay focused and keep this trend up. We've seen decreases similarly before, and then unfortunately we had some more spikes after that. And so if we can really focus on what we're doing that got us to this point, which is following those recommendations and being smart about our gatherings and what we're doing, we can keep that trend going in the right direction. And then I just really would like to urge people to, write letters to your nursing homes, your healthcare workers, voice your, support on social media. That stuff really, it makes a big difference, especially now when everyone's, we're all fighting that same fatigue. Again, we've been going at this for months now. And so those little words of encouragement, they can just really mean the world. And I know here in Shawnee County, as far as the vaccine goes, we're currently working phase 2 in and continuing with phase 1, healthcare workers, healthcare associated workers, and then down through the state's phase 2 guidelines as well. So we're real excited about that. We're working with all of our private providers here in the county very closely. We've had some discussions with other counties and just trying to communicate with each other to provide the best that we can for our differing populations. Thank you.
Thanks, Derek. Hey, I'm asking this question on every call, but and you may not know this for surrounding counties, but do you know if you guys have a place to sign up if someone's wanting to get notified when it's their turn or when they can sign up?
Yeah. If you go to our website, which, give me just a moment here and I'll get you so if you go to snco.us/HD, there should be a button on that website that will actually get you to our county survey. I can't speak to some of the other surrounding counties. I think they're doing similar things, but taking the survey will allow you to kind of identify yourself in the phase, input your information so we can gather that and then work down that list, get our private providers notified, and we'll get you taken care of when the time is right.
Okay, thank you very much. Let me pass it over to our friend Sarah here from the hospitals.
Thanks, John. My name is Sarah Gideon. I'm the director for the Health Innovation Network of Kansas. So on a day-to-day basis, I work with 16 hospitals in Northeast Kansas. For the purpose of these calls, we represent about 21 different counties and an assortment of hospitals, large and small. Mostly, I wanted to reiterate, we have seen a decrease in our hospitalized COVID patients. We still continue to see a need for patient beds for other things, falls, car accidents, wounds, cancer, whatever that might be. So those healthcare needs have not gone away. In the last year, COVID has added another layer of need on top of that. So while our hospitals have seen a decline in our COVID patients, they're still taking care of their friends and family in their communities. For some of them, I've heard recently, they do feel like they're taking a little bit of a breath. They're finally not seeing a single COVID positive staff member, or they have a lot less on quarantine than what they have in the past. They've started to see the level of vaccine uptake in their facilities for their healthcare workers to increase, which has been has added a lot of hope for those that are really at the front lines of fighting this disease when it hits the hospitals. Within our region, public health is the primary point of contact for our vaccinations. Within different counties, we are seeing where hospitals are getting involved in providing staff resources, maybe answering phones, et cetera. So really coming at it from a team perspective. And so we really appreciate our public health partners in this. We really appreciate our hospitals for continuing to work to get our communities healthy again. We have seen a reduction in flu hospitalizations, those public health things that Derek talked about, the social distancing, the wearing of masks, washing our hands. That's all helped to really reduce some of those other needs that we would see at this time. So I would just really encourage people to continue those things. And today I wanted to introduce our special guest, our boots on the ground perspective. Jennifer Gehring is the Chief Nursing Officer at Ascension via Christie in Manhattan. So Jennifer, I'm going to turn it over to you to talk about what you're seeing in your facility with your staff and within your community.
Thank you, Sarah. Again, I appreciate being asked to come on here, and I could go ditto to almost everything you just said, because that's exactly what we're seeing. We had all-time high numbers into the beginning of last week with our COVID, and we're back down to seeing we have about 9 patients in-house currently. But the one thing we are seeing is back to that trend where patients are trying to avoid hospitals. They've been avoiding. So we're seeing very sick non-COVID patients come in because they have waited so long to get any healthcare treatment. So, that's the biggest thing I can urge is how do we make sure people recognize that they need to get out, especially with those chronic illnesses, continue with their follow-up appointments with their primary care providers, their specialists, because that is the one thing. I'm actually at an all-time high on number of patients just because most of them are non-COVID related now because of this. So, and I'm assuming that's very, very similar to a lot of the other hospitals that we're in contact with every day, that they are just seeing that as they open up ICU beds and medical beds, they're filling them with non-COVID patients right now.
Great. Thanks, Jennifer.
That's great, Jennifer. Thanks for all you guys are doing in Manhattan. Let me pass it over here to Dr. Watson. Make him the host. There you go. Dr. Watson, if you give us a paint picture on the transfers.
Yeah, it's interesting. Northeast part of the state, across the board, there's more capacity. Obviously now, when we're seeing more green and yellow than we are red, that's really unusual. That hasn't happened for probably 3-4 months here. So much better, and definitely there's some regional change to it. I think the Northeast area has been different. And I think on John's graph, he showed almost the plateau at the level. It had decreased some, but it's kind of holding its own here. And we've got about half of the transport still looking for beds, which although the volume has eased maybe some, the patients are sicker. There are more non-COVID patients, and it's actually harder to find a bed than it was even a week or two ago. Some of these patients, if you get into the COVID patients, are 3+ hours waiting for transport to a receiving facility. So while I think the overall picture shows that there's easing, I mean, this whole thing of the good news is that the healthcare workers aren't as sick. I mean, that tells us where we're at, honestly, because that's the critical part here, that it's gotten so bad that not having staff because they're ill, that's probably the worst place we can be. So I think overall it's a little bit slower than the rest of the state to open up and to present capacity and means to move people. The good news is volume is continuing to decrease, and I think over the next couple of weeks we'll at least see that. I always think the rebound phenomena that was talked about is interesting, and mental health the same way, is that you would think during the real tough times mental health issues would be the worst, but it tends to make people more reclusive, and then all of a sudden it just bursts forth and you've got just a wave of all these things, people that are much sicker than they normally would be had there not been the fear that for some reason they would get COVID if they went to the hospital. So the volume changes, but particularly what we're seeing now is kind of a plateau related to all the above. COVID better, everything else stepping up and filling what would be the slack here.
Thank you, Dr. Watson. And do you mind making me the host again?
There you go.
There we go. And so I don't know what's happened with Dr. Nielsen. She may have gotten pulled into something else. I just tried calling her, but I can give an update based on what she said. So let me start by, hold on one second here. I'm going to share this dashboard that we looked at last week. So when you go to, let me make sure I say this right, kansasvaccine.gov, kansasvaccine.gov, and you click on data here, you can pull up our vaccine overview. Now they've revamped this a little bit since we looked at it last week. You can see number of people vaccinated, first and second dose here, the doses that are coming into the state, and the percent of the state that we vaccinated. So that was 3.5% last week. We're at 4.5% this week, which is improvement. And then they've come, and you can get some of the information here. So by age, by gender, by manufacturer, Moderna versus Pfizer, and then first and second shot by day and how that's going also. And then coming down here, you can see how the doses are distributed by county. And this is for the week of January 25th. And so you can see how this moves. And I'm going to put Derek on the spot real quick. Derek, do you have an idea in Shawnee County how many people would be in phase 2?
About 65,000.
Yeah, so you can see Shawnee received just under 2,000 last week, and they're tackling phase 2 of 65,000. So we're all hopeful that we'll be getting more in from the federal government to help with this. But when you're taking a crack at 2,000 a week, that's why you're hearing this call that you got to be patient, and that they are putting the jabs in the arms as fast as they can. But this is the reality that we're dealing with. You can see Sedgwick County on here, which is where Wichita is, just under 6,000. They'd gotten 2,000 the week before, and they have somewhere around 150,000 people in phase 2, I believe. So very frustrating, I think, for everybody who would like to see more coming out. Now, Marcy has shared that they do have an algorithm that the state's using to figure these out, and a lot of that's population and the number of people that are in these more severe conditions. There's the social equity piece of this. As we know, this has hit different populations harder than others, and so they kind of put it through that algorithm, and it helps them know where to send these things out every week. I've really high hopes for Dr. Nielsen. She'd been part-time leading up to this effort. It started full-time this week, and has had some experience around this for a long time. And I think as far as Kansas communication and all that will be very helpful. Is there anything, without her on here, is there anything that anybody else would like to add as far as the vaccine rollout goes for the state? Or things they'd like to discuss on this call?
I think just appreciative of all the communication back and forth. I always kind of tell our partners, and even when we discuss things with some of the people on the state level, it's like, just take a breath. This is a big, big undertaking. It really is, when you step back and think about the number of people that we're trying to vaccinate. And to that point, we're very excited that a lot of people want to be vaccinated. I mean, that's exciting in itself. So it's a process to work through it. We can only work with what we have. The state's working with what they have. And so we'll get you vaccinated. Just give us the chance.
I would echo what Derek said. Insofar as, we have some really committed public health departments, really committed healthcare within our region. And they want nothing more than to see people be healthy. To see our state be healthy. And I would just encourage people to extend grace, and to also take a moment. If you've completed the survey, your name is on the list, you will get that phone call hopefully sooner rather than later. But our public health departments are working hard, not only on COVID, but they have other patient care needs, just as our hospitals do. And so just continue to do those things that can support your local healthcare workers, whether it's public health or your nursing home or your hospitals. We're continuing to slog through this together, but it will go better if we can be supportive of one another.
Thanks, Sarah. Yeah, and I'd say, just as a qualifier there, not every county has a place where you can sign up and be notified once your turn, but every county is running this process through phase 2 uniquely to that county's population and how it works. And so really be leaning in on your county health department. Said in an earlier call, try and check the website and their Facebook page first to save them from answering another phone call. But if you can't find the information you need that way, then do give them a call. They really want to be helpful. We like to end with bright spots. You know, I don't know if you guys have one from this region. I have a couple from the state. Did anybody have something from this region? Okay. You know, someone in Pratt, Kansas, a couple donors donated 95 grand and helped pay off 430 families medical bills. Kind of a surprise gift, really cool. And then I just heard one of my favorite of this whole pandemic out of Eureka, Kansas, and the Greenwood County Hospital. A person fell and broke their hip and was in and let their nurse, while they were being treated, know that they had a dog at their house that they were worried about. And that nurse went and picked up the dog and has been caring for it at her home while this person is recovering from their hip injury. Just a beautiful picture of the personalized love and care that so many people in the healthcare system are giving and the ways that they are stepping up above and beyond right now. So I was really touched by that story. I hope you guys are too. There's a lot of good people in this state, and we're going to do our best to get this vaccine going and to be communicating out to the public what they can expect. The state is only getting 1 week notice on how much vaccine is coming to the state right now. There's been a request federally at least have 2 weeks. And I know it sounds like the Biden administration is wanting to do that. So hopefully things will continue to get better and just encourage people to keep doing what they can to keep the spread down. So thank you, everybody, for being here this week. We'll be here next week. Again, you can sign up at covid.ks.gov/report-outs. You get the email with the dashboard and the link to this call. And if you have any questions for us, ksregionalreport@gmail.com. If you're looking for a place to get tested, go gettested.com/Kansas. And for vaccine information, kansasvaccine.gov. How's that for some websites? Anybody, thank you guys very much for being here and on this call. And we'll see you this time